Hello, welcome back to Constitutional Drug Series. This is Dr. Gayatri, BHMS and RABT counselor. Today we are going to discuss a drug called Thuja. Thuja physical appearance we will discuss first. He or she is like a Lord Ganesha, means उसके round belly होगी, distended abdomen, large head or long large ears, then thick coated tongue, thick and rough skin, rough look of the face. So that kind of personality is usually Thuja. On skin, there are warts present and moles present, freckles on face. So these are general characteristics of Thuja patient. Now we will go to the first paragraph of Boric. Thuja is a polycrest drug and a psychotic drug having hydrogenoid constitution. It acts on skin, blood, GIT, kidneys and brain and produces vegetations, condylomate, warty excrescences, spongy tumors is very important. So whatever cyst, tumors, warts, condylomatas, all they come under Thuja because it is a psychotic drug. Everywhere, every organ or every complaint, if it is having psychotic background or growth, overgrowth, any kind of, then we can think of giving Thuja if the constitution matches. Main action of Thuja is on the skin and genitourinary organs, producing conditions that corresponds with Hahnemann's psychotic dyscrasia. It has a specific antibacterial action as in gonorrhea and vaccination. So ill effects after vaccination, two drugs, Thuja and Cilicia, we can think of. Psychotic pains are there, that is, there is tearing pains in the muscles and joints which are worst at rest. Usually the complaints are better by rest, but here it is worse at rest and better in dry weather. Worse, damp, humid atmosphere, and there is lameness. There is a rapid emaciation or exhaustion. Thuja is chilly medicine and left-sided medicine. Variola aborts the pustule and prevents suppurating fever. Vaccinosis, inevitable skin troubles, neuralgia, etc. So here in short we can summarize this as warty growths, psychotic background, excrescences. It has major action on skin and genitourinary organs. There is rapid emaciation. It is a left-sided and chilly medicine. Can be given for recurrency of fever. If any child is suffering from chronic URTI or fever complaints, or for example acute chronic rhinitis, not acute, chronic rhinitis, chronic recurrent complaints are there of any respiratory complaints, then we can think of Thuja. Even nasal polyps, we can think of Thuja. Okay, so now we will go to mind complaints. Fixed ideas. He is very much angry if given for a male person. He or Thuja can be given for both female as well as male, but predominantly it is a male remedy, but can be given for female as well. And to find out or to identify female constitution, they are usually tall with rough skin, rough elbows, warts present over the neck, and they are having large abdomen, hips, fat distribution around hips and abdomen. So this is Thuja personality, female. They have rounded face as well, and as compared to men, sharp features in female. So this is seen. Emotional sensitiveness is present. Music causes weeping and trembling. He feels as if strange person is there at his side. One more thing and it is a keynote that Thuja person fears of height very much. He or she feels vertigo sensation or imbalance like sensation if she looks or he looks down from a height. So this is very much important keynote, that is fears of height. Headache, pain as if pierced by a nail. Two remedies, again they are given, coffee and ignatia. Neuralgia is present, left sided headache, as it is left sided medicine but can be given to right side as well. There is no hard and fast rule, like um, as we have already discussed that sepia, pulsatilla and atramure, both these are female remedies predominantly but can be given to male as well if constitution matches. Thuja can be given for dandruff, alopecia also, falling out of hairs, and there is greasy and rough skin of face. So this is one of the physical feature you can look for: waxy greasy skin and rough skin along with thick coated tongue and thick skin. These both are keynotes. It can be given for styes, recurrent styes and tarsal tumors, chalazion, etc. So anywhere there is a growth, overgrowth complaints, so you can think of giving Thuja. It can be given for chronic otitis media, where discharges are purulent, and polyps of ears, polyps of nose, there is dryness of nose, thick greenish kind of mucus is present, and painful pressure at the root. Tip of the tongue is painful, teeth decay next to gums, sensitive teeth, ranula. It is a very good remedy for ranula. If you google the image of ranula, you will get to know the condition. So it is very good remedy for ranula, the topmost drug to give. Can be given for varicose veins on tongue and mouth. There is complete loss of appetite, dislike of fresh meat and potatoes, rancid eructations after food, cutting pain in epigastrium. It can be given for tea drinkers, like there is desire for this kind of hot tea drinking, and because of that there are complaints, stomach complaints such as dyspepsia, flatulence or GERD complaints. Cannot eat onions but still desires onions. This is very much important symptom of Thuja. Craving for raw onions. So this is again a confirmatory symptom, craving for raw onions, but still there are affections of stomach because of that. Abdomen distended, discharges forcibly expelled, gurgling sound, flatulence and distension protruding here and there, rumbling with colic. Constipation is present with violent rectal pain causing stool to recede. This is again a keynote symptom seen in Cilicia also. Can be given for piles. Pain worse sitting with stitching. There are stitching and burning pains, as it is a psychotic drug, so stitching pain is the characteristic pain of this remedy. Movements as if something living without pain. It is seen in rectum as well as abdomen. Then we'll go to genitourinary complaints. Urethra swollen, severe cutting pains are present. We can think of giving it those who have suffered from gonorrhea or there is gonorrheal history in family. Desire and sudden urge but cannot be controlled. So this is again a keynote. In case of renal calculi or UTI, recurrent UTI, you can think desire is sudden and urgent but cannot be controlled. Paralysis of a sphincter vesicae. It can be given for prostate complaints also. Inflammation of prepuce and glands, pain in penis, balanitis, a good remedy for balanitis, male complaints. Itching is there, rough skin, then discharges may be present, so we can think of giving for balanitis also. Gonorrheal rheumatism, gonorrhea, chronic induration of testicles, pain and burning felt near the neck of the bladder, prostatic enlargement. Another drugs given, ferrum picricum, sabalcerulita, thiocinaminum iodum, etc. One more thing I would like to tell, that even if constitutional drug can be pulsatilla or natramur and you have given it and the patient is still suffering, so we can think of Thuja as a miasmatic, miasmatic clearance remedy, or you can give it intercurrently, like we give nozodes for intercurrent purpose. So Thuja is also that kind of drug which clears the miasmatic background. So yeah, female complaints, vagina is very sensitive, warty excrescences on vulva and perineum, menses are scanty, retarded, like it can be given for female complaints such as left ovarian cyst, left uterine polyp, ovaritis, worse left side at every menstrual period. Profuse perspiration before menses is another keynote. So we can think of any extra growths in female complaints. Respiratory complaints, asthma in children, stitching pains in the chest, dry hacking cough, chronic laryngitis, and one more thing is very much important. There is worse, all the complaints are worse by cold drinks and damp weather. Okay, extremities complaints, there is a kind of imagination or mind. This is one of the important mind symptom. When walking, Thuja person feels as if the limbs are made up of wood or glass and would break easily. So this is imagination. Tips of fingers swollen, red, muscular twitchings, weakness and trembling, crackling in joints, pain in heels and tendo Achilles. Ingrowing toenail, a very useful remedy for ingrowing toenail. Very much important remedy for ingrowing toenail. Skin complaints, polypi, tubercles, warts, carbuncles, ulcers, dry skin, rough skin with brown spots. It can be given for herpetic eruptions as well. Okay. One more important keynote is eruptions only on covered parts. So uncovered parts will not be affected. Covered parts will be affected and worse after scratching. Brown spots is another physical appearance. You can confirm it for look. Then there is insomnia, fever. Usually it is not acute remedy, so will not discuss this. Modalities, worse at night from 3 a.m. and from 3 a.m. that person is worse, and 3 p.m. this is a characteristic modality. So any complaint such as knee pain or whatever gastric disturbances, worse at 3 p.m. or 3 a.m. Even chills, we can give it for recurrent fever or recurrent URTI. So the attack is usually aggravated at 3 a.m. So we can think of giving Thuja. From damp air and cold drinks, cold air, that person is worse. Better by lying on left side and while drawing up limb. So this is Thuja drug, mainly a hydrogenoid constitution and psychotic background drug. Warts present, tall, there are skin is rough, dark rough elbows, and Ganesha like look, round face, large head, large ears, round belly, distension present, itchiness near groins, then fear of heights, and fixed ideas and imaginary things are present. Any overgrowths, any kind of overgrowths we can think of giving thuja, cyst, polyps, abscess, etc. Thuja person is quite anxious, like that of lycopodium. So there is anxiety with anger, and there is desire for this hot tea present. So this is thuja. Will compare it with lycopodium whenever we'll discuss lycopodium drug, because both these drugs, they are little bit kind of similar, but look wise thuja person is very much different and lyco person is very much different. So that is a major difference, as thuja person is bulky, obese, has rough skin and waxy skin, dark hair, dark complexion, warts are more prominent than lycopodium. So yes, we'll discuss that further. Any doubt related to this drug, that is thuja, you can comment, and we'll discuss that. Or if we have discussed like now pulsatilla, sepia, phosphorus, lacasis, the previous drugs, any doubt from that also you can comment and we'll discuss. Yes, so this is the major important drug. You can go through Philip Bailey and Boric and Nash if you want, and read it. Because whatever we have discussed this just now in Boric, mostly Nash has described the same. So just go through, even go through Kent, JT Kent, that has been a very good description by Dr. Kent. Once just to go through. Yes, bye bye, thank you.